Understanding anxiety disorders and why stress is a major factor. Hello, welcome to my channel. In today's video, I will tell you about anxiety disorder. But before we start, please subscribe to my channel and hit the notification bell. Thank you. Understanding anxiety disorders and why stress is a major factor. Anxiety disorders are the most common mental illness in Western countries, affecting more than 40 million people. They are characterized by persistent worry and tension, often lasting for months or years. People with anxiety disorders may have such intense fear that they avoid places or activities where they might encounter what they fear, or where it might be difficult to escape. Anxiety disorders are a group of mental illnesses that can make a person feel fearful, worried and full of tension nearly all the time, even when there is little or nothing to provoke it. People with anxiety disorders often have recurring intrusive thoughts or concerns. They also often have physical symptoms, such as headaches, stomachaches, and breathing difficulties. According to the experts, anxiety disorders are the most common mental health problem in the United States. The Anxiety and Depression Association of America estimates that 40 million people, 18% of all U.S. adults, deal with an anxiety disorder each year. Anxiety disorders tend to develop early in life. In many cases, it begins in childhood or adolescence and continues into adulthood. What are anxiety disorders? Anxiety disorders are a group of conditions that involve excessive and uncontrollable worry. Anxiety disorders frequently co-occur with depression and substance abuse, and the presence of these disorders can also be a sign of incipient dementia. People who suffer from anxiety disorders usually develop them during adolescence or early adulthood. They may be more likely to develop an anxiety disorder if they have a family history of the condition or other psychiatric disorders. What are the types of anxiety disorders? Anxiety disorders include generalized anxiety disorder, GAD, panic disorder, phobias, and obsessive-compulsive disorder, OCD. People who have an anxiety disorder may also have post-traumatic stress disorder, PTSD, or another mood disorder that causes symptoms similar to those of an anxiety disorder. Some people with substance use disorders also have an anxiety disorder, but it's not clear whether the substance use caused it or if it was there all along but went unnoticed until someone tried to stop using drugs or alcohol. Anxiety disorders are a group of mental health conditions that cause excessive and often irrational worry and fear. Anxiety disorders commonly occur with other mental health conditions, particularly depression. What causes an anxiety disorder? The causes of anxiety disorders are unclear, but they seem to be related to a combination of factors, including genetics. Some people may inherit a tendency to develop anxiety disorders from their parents or family members. Environment, stressful situations or traumatic events can trigger an episode of anxiety disorder in some people who may be genetically predisposed to it. Brain chemistry, certain brain chemicals seem to play a role in causing anxiety disorders, including serotonin and GABA, gamma-aminobutyric acid, which are neurotransmitters that send information between brain cells, norepinephrine, which helps maintain alertness, and dopamine, which affects pleasure-seeking behavior and emotional responses such as fear. What are common symptoms of anxiety disorders? The most common symptoms of anxiety disorders are panic attacks that happen suddenly and without warning. Panic attacks usually last only a few minutes and often include chest pain, heart palpitations, sweating, trembling, and feelings of terror. Fear of being in situations where escape may be difficult, agoraphobia, or embarrassing, social phobia. These fears can lead to avoidance of public places, especially when the anxiety is severe. Distressing thoughts that you find hard to control or get rid of. For example, People with obsessive-compulsive disorder have persistent and unwanted thoughts, obsessions, that make them feel anxious, such as fear that their hands are contaminated with germs. People with panic disorder may have recurring thoughts about dying from a heart attack or another medical illness. People with post-traumatic stress disorder may have distressing memories of a traumatic event over and over again,